A lot of people come to me, send me messages about their neck hump and their concerns. Just slide this up a little higher. So we've got the skull, and then we've got each of the vertebrae that make up the neck curve. Now, ideally, we would have a nice C shape all the way down, but in this particular individual, we've got a C shape and then a kink. And this is the problem. This is what's giving this person their neck hump, and nothing to do with just faulty slouching posture. And let's look at the bottom vertebra here. So here we have the problem. This is where the spine is kinking the wrong way. In fact, it's actually worn that disc fairly substantially. This is not somebody who's been slouching or hanging their head forward for a number of years. This is a classic trauma. This person could have headaches, neck pain, arm symptoms, or no symptoms. Their only symptom may be that they're aware that there's a lot of fatty deposits laid down on the neck here.
So now let's take a look at the ideal neck curve here on the left. We call that a cervical lordosis, where the curve, the green curve, goes in, a nice arc in. The spaces between each of the vertebrae nice and wide. And the neck joints, you can see a couple of them between the yellow oval circle. Again, they're nice and wide, lots of cartilage there. On the right, we see a cervical kyphosis, or a reversed neck curve. And you can see that the curve starts out near the top, fairly close to the green arc, and then completely reverses. And where you see the yellow arrow, it's reversed the most dramatically at this point, and that's why the disc is wearing down. The bones are very close together, and you can even see some pointy bone spurs at the front. And on this person, there's a fatty neck hump that looks like you see here on my students. Each of them have had car accidents. Remember, neck curves that go wrong or reverse are always due to trauma, and car accidents are very common. Here you can see the visual appearance of a fatty neck hump, and you can understand why people become very self-conscious about this particular problem. Here's a great example. Another student of mine brought an x-ray to me, and again you can see there's a loss of the normal curve. Not bad 1, 2, 3, and 4, but really from about 4 down to the last vertebra, 7, it really flattens out. Again, another car accident. If you look closely on vertebra number 5 at the bottom front, there's a small bone spur, and that disc, the disc between 5 and 6, is slightly narrowed, and you can definitely see clearly the fatty neck hump here at the back. So we spend a lot of time looking at the outside of the body and trying to diagnose our posture problems. But posture is an inside job. If we want to correct our outer posture, we need to address the structural alignment of the inner spine. And to do that, we need to know what our spine looks like. And for that, we need to have an x-ray. Without a doubt, your chiropractor is the expert for taking spinal x-rays to measure alignment and posture. So once you have a structural diagnosis, in this case we used a reverse neck curve as an example, you probably want to know how to correct this structural problem. And to do this, we use something called a mirror image exercise. So the mirror image is the opposite direction to the incorrect posture. Makes sense, right? So if you got a reverse neck curve, in other words, your neck curve is permanently flexed forward into a kinked position, then the mirror image is neck extension, or having the head come backward, a little bit like this. This is the mirror image exercise for someone with a cervical kyphosis. And finally, you're probably wondering, how long will this structural correction take? This is where making a commitment to improving your posture is key. When you've received a structural diagnosis, and in this example, we used a cervical kyphosis or a reverse neck curve, you should expect to continue your mirror image exercise for a minimum of 6 months and usually up to 2 years. But fear not, the very great news, once you've corrected your structural posture issue, you never need to do your mirror image exercises again. But it's likely you'll want to carry on with your daily posture training exercises because they're really fun. And does this work? You better believe it does. This is my lovely student, Gabby M. She had chronic headaches and had this x-ray to show me here on the left, where you clearly see her problem, a cervical kyphosis, a reverse neck curve. She began my posture training program, which included a mirror image exercise for her neck curve. 6 months later, she had a follow-up x-ray, and this was her result here on the right. I think you'll agree this is a pretty darn impressive outcome. Yay, Gabby, you rock.